Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. This podcast is on the New England Journal of Medicine article released today, hot off the press. It's on catheter ablation or antiarrhythmic drugs for ventricular tachycardia and ischemic cardiomyopathy. The objective was to determine if catheter ablation is superior to antiarrhythmic drugs as first-line therapy for VT and ischemic cardiomyopathy. It's a VANISH2 trial. The study design, multi-center international randomized trial, 416 patients with prior MI and VT. Median follow-up was 4.3 years. Interventions, catheter ablation within 14 days of randomization. Group 2 was antiarrhythmic drugs, sotalol or amiodarone. Primary endpoint was a composite of all-cause mortality or VT events requiring ICD intervention or medical treatment. Primary endpoint results, 50.7% in the ablation group and 60.6% in the drug therapy group. The p-value is 0.03. Ablation significantly reduced risk. Secondary outcomes, all-cause mortality, 22% in the ablation group, 25% in the drug therapy group. Appropriate ICD shock after 14 days, 29.6% versus 38%. VT storm occurrence, 21.7% in the ablation group and 23.5% in the drug therapy group. Sustained VT requiring medical intervention was only 4.4% in the ablation group versus 16.4% in the drug therapy group. P-value less than 0.001. Safety and adverse events. In the ablation group, death was 1%. Non-fatal serious adverse events was 11.3%. Drug therapy group, death from pulmonary toxicity was 0.5%. Non-fatal serious adverse events was 21.6%. Clinical implications, catheter ablation should be considered early in VT treatment strategy for ischemic cardiomyopathy. While ablation has procedure-related risks, overall benefit-risk ratio favors ablation over drug therapy. Findings support a shift towards first-line ablation instead of drug escalation for VT suppression.